Pemphigus vulgaris histopathology focuses on the examination and understanding of the tissue samples affected by pemphigus vulgaris, a rare autoimmune disease that affects the skin and mucous membranes. This detailed examination plays a crucial role in diagnosing and managing this condition. Histopathology is a specialized field within pathology that involves the study of tissues under a microscope. In the case of pemphigus vulgaris, histopathology allows pathologists to analyze and identify specific changes that occur in the skin and mucous membranes affected by this disease. When a tissue sample is obtained from a patient suspected of having pemphigus vulgaris, it undergoes a series of laboratory procedures to prepare it for histopathological examination. This typically involves fixation, embedding, sectioning, staining, and mounting on slides for microscopic observation. Under the microscope, pathologists are looking for characteristic features of pemphigus vulgaris histopathology. These include the presence of acantholysis, a phenomenon where the cells of the epidermis become separated from each other due to the breakdown of intercellular connections. This separation creates space, or cavities called bullae, which can be detected in the affected tissues. In addition to acantholysis, pathologists also observe other changes such as infiltration of inflammatory cells, including lymphocytes, neutrophils, and eosinophils in the affected areas. These inflammatory cells contribute to the formation of blisters and erosion seen in pemphigus vulgaris. Histopathological examination not only aids in confirming the diagnosis of pemphigus vulgaris, but also helps in differentiating it from other blistering diseases with similar clinical presentations. This differentiation is crucial, as the treatment strategies for different blistering disorders may vary. In conclusion, pemphigus vulgaris histopathology is an essential tool in the diagnosis and management of this autoimmune disease. By examining tissue samples under the microscope, pathologists can identify specific changes that help distinguish pemphigus vulgaris from other similar conditions. This knowledge enables physicians to provide appropriate treatment and care to their patients.